Hello, my name is Diana, and I'll be showing you how to do a health assessment today. The first step would be inspecting the area for abnormalities. Palpate by applying light pressure with your fingertips. And percussing, which is the next step, is also light tapping with the fingertips. Percussing depicts any fluid within the tissues or masses. Auscultation, which is listening to the different body organs with the stethoscope, also takes place within the health assessment. Hand washing in between the patients is very important, and also using gloves is important into preventing infection from one patient to the next in you. The first thing that I'm going to be doing is introducing myself and informing my patient the reason why I am there in the first place. I'm going to use two forms of identifiers. Using their armbands, I'm going to be asking them if what is their name and their date of birth, so that I can make sure that I'm doing the assessment on the right patient in question. After that, I will be collecting their vital signs: temperature, pulse, respiration, and blood pressure. Pain is the fifth vital sign, um, and is showed as PQRST, the mnemonics that has been created for pain. P as what provokes the pain, Q is the quality of the pain, R the radiation, S is the severity of it, and T as the time that it has been there. Um, then we go ahead and perform a general survey. General survey is we know that as soon as we come into the room, general appearance, behavior, affect, posture and movement, and grooming is um, good insight into the general survey of the person itself. Um, then after we do all of the steps, we go ahead and do the head-to-toe assessment. Um, we start with the neurological part of it. We gonna ask the patient the time and if they know if it was the time and place that they are right now, and by this we establish awareness on the patient. Simple questions: do you know who you are and where you are? Communication and speech is important on the neurological assessment, because if their speech is slurred and their communication doesn't quite add up to what you're saying, then that might be a problem in the neural system. Short-term memory is assessed by simply asking them, what do you have for lunch or what do you have for breakfast? It could depict that. The eyes, we can start inspecting the eyes as soon as we come into the room. If the patient follows us um, with their eyes, we can definitely assess that as a positive neurological assessment. Then we can go ahead and check pupil constriction. We can use our pen light, and we're going to shine a pen light through the side. We're going to do the same thing on the other side. As we do this, we check for pupil constriction. As they constrict, we make sure that they have a normal neurological reaction to the light, which is what we're looking for. Then we go ahead and assess the head. The head, we assess that there's symmetrical, that there's no dandruff or lice in the hair. Then we go ahead and look at the nose. We just check for symmetry, any redness, swelling, um, drainage should also be noted on the nose. Then going through to the mouth, we're gonna look at the teeth, the gums, any dentures or false teeth. Um, on the gums, we're gonna check that they're not receding, swelling or irritated, or there's any open sores and tenderness within the mouth. Any tubes should also be assessed in the nasogastric of ET tubes should be assessed for patency and should be accurately documented. The mouth should be moist and the lips should have no cracks. Cracks is a sign of dehydration, which should be further assessed. Gag reflex um, is a very important part of the mouth assessment, and swallowing should happen without any coughing. When giving medications, before giving medications, we should make sure that the patient has a gag reflex, um, so that no choking takes place. Then we go ahead and assess the neck. We go ahead and look and palpate under the jawline. We're gonna look at sense the lymph nodes. We're gonna check for any tenderness or swelling. Tenderness is a clear sign of infection and should be further inspected. As we go through the assessment, we check the skin. Hydration status or any open areas is clearly noted within the skin when performing our assessment. On the skin, we're going to look at color, pigmentation, bruising, open areas, ulcers that can create um, breakdown. IV catheters also need to be assessed, and redness, swelling, drainage, or infection should be accurately documented. Pressure source areas are within the elbows, sacrum, behind the knee, backside, and also under the ankles. Redness, the skin once it starts to get red and it starts to break down, it's very hard to reverse it. So prevention by turning the patient every 2 hours constantly, it's major so that we can prevent any breakdown. The skin should be warm, intact, dry, not um, skin trigger is also a hydration, check as a hydration status. A normal adult individual we will check by the arm if the skin should go back instantaneously, and that's a good sign of hydration. When we have an elder um, patient, we go ahead and do it in the forehead or in the chest, since the skin becomes more flaccid. Um, Chest and thorax assessment. We want to do this by removing any clothing from break inspection. We're going to know any symmetry or asymmetry or deviations, chest wall movement, retractions. We need to know the normal so that we can assess the abnormal part of it. The respiration is at 12 to 20 beats per minute, um, rate per minute. We're going to know any deep or shallow respirations. We're going to know if the patient has any oxygen and if the oxygen is actually flowing correctly. And also the saturation is really 96, about 96 to 100%. We're going to palpate the chest and do chest excursions for tenderness. We're going to check for tenderness. Then we're going to percuss between the ribs, and should be when percussing between the ribs, it should be resonance. Dullness is a sign of fluid or masses in that region. Um, After we percuss, we go ahead and auscultate. We start above the clavicle and we check side to side. For adventitious signs, which are adventitious sounds, which are crackles, pleural rub, and rails, or any cough that the patient might be having, should also be further assessed. Then we go ahead and listen to the heart. Um, we start by assessing second intercostal space, the right, second intercostal space, right. Then we go ahead and that's the aortic. Then we go to the left intercostal space and that's pulmonic. Third, earth point. Fourth, straight cuspid. Fifth, mid-clavicular line is the apical pulse. 60 to 100 beats per minute is the normal. While doing this, we are assessing for murmurs. Any excess fluid, which is excess fluid escaping from the valves, is a swishing sound. Um, Accurate documentation is important. Abdomen, when assessing the abdomen, we're gonna check for lesions, striae, openings, swelling. We're gonna observe pulsations. We're going to divide the abdomen in four um, for this purpose, but it's also divided in nine for pain purposes. Um, on the abdomen, we first auscultate, we first observe, and then we auscultate, so that we don't disrupt any bowel movement. Sounds, we start by the right lower abdomen, working your way down. The sounds is 35 to 30 times per minute. Um, Absent bowel sounds, um, when they are noted, it could mean any obstruction or after abdominal surgery is also noted. As a nurse, when having abdominal surgery, a patient with abdominal surgery, we need to note this because we need to see when is the patient having their bowel sounds back. This is a good time to ask about diet and exercise. Pain medication also creates constipation, so it's a good um, time to ask about that. And also bowel patterns is important. Um, when noting the extremities, we're gonna know for any edema, and it's rated +1 to +4. Redness or swelling, it's important to know. Holman sign. Holman sign is important to collect because it can tell you if the patient has any blood clots. Capillary refill should be collected in both the fingertips and the toes. It should be less than 3 seconds, and if it's over that, then we have a vascular problem with oxygenation. When assessing the urinary system, we need to know the voiding patterns, color, amount, frequency. Frequency and burning on urination is a clear sign of infection and should be further assessed. Output is the normal is 30 cc per hour, and the perineum should also be assessed. The musculoskeletal system is assessed by noting if how they walk, if they have a steady gait, if they're using any necessary equipment to help them walk. Further assessment should be noted, should be done when this happens. Um, uh, Also, any Foley's, Jackson Pratt, IV, NG tubes, so on, should also be noted when inspecting your patient because those are items that need to be documented on within different times within the shift. When finishing the assessment, we need to put the bed down, call the reach, side rails up to the standards of the facility and the state. And also, we're going to ask the patient if they have any questions or concerns um, that you could cover. And that will be all for my physical assessment class. Thank you so much.